India now has over 101 million people living with diabetes, and almost 3 out of 4 Indians struggle to maintain healthy blood sugar levels. Globally, we are looking at 589 million adults living with diabetes, projected to rise to about 853 million by 2050. To help us unpack this, we are joined today by two leading experts. Dr. Jeffrey Mechanic, endocrinologist and professor of medicine, Mount Sinai Hospital, USA, and Professor Agnes Seolingte, senior lead clinical science and nutrition, Abbott Asia Pacific R&D Center. No matter how much you think you want to exercise, you want to talk about nutrition, you want to change your habits, the challenges are still many.
It's really about awareness.
Managing it is a 365-day partnership between lifestyle, nutrition, treatment, and consistent habits. With advances in science-based nutrition and diabetes-specific formulas, people today have far more tools to take control with confidence and predictability.
With diabetes-specific formula, it is very easy to incorporate into the diet. It's the right nutrition in the right proportion every single time.
Hello and a very warm welcome. We are so glad to have you with us for this special episode in collaboration with Abbott India. Let's begin with a reality check that touches nearly every Indian family today. India now has over 101 million people living with diabetes, and almost 3 out of 4 Indians struggle to maintain healthy blood sugar levels. Globally, we are looking at 589 million adults living with diabetes, projected to rise to about 853 million by 2050. Now, these numbers aren't just statistics. They reflect the everyday challenges millions navigate at home, at work, in their daily routines. And we have just marked World Diabetes Day, but of course, diabetes doesn't follow a calendar. Managing it is a 365-day partnership between lifestyle, nutrition, treatment, and consistent habits. With advances in science-based nutrition and diabetes-specific formulas, people today have far more tools to take control with confidence and predictability. To help us unpack this, we are joined today by two leading experts. Dr. Jeffrey Mechanic, endocrinologist and professor of medicine, Mount Sinai Hospital, USA, and Professor Agnes Seolingte, senior lead clinical science and nutrition, Abbott Asia Pacific R&D Center. And together, they will both help us understand how structured nutrition can elevate diabetes management and how diabetes-specific formulas fit meaningfully into real everyday routines. So let's dive in. First of all, welcome to the studio.
Thank you. Thank you. Great to be here.
I can't wait to ask you so many questions that I'm asking on behalf of millions of people in India who are living with diabetes, managing diabetes, suffering from diabetes at many a times. It is very challenging because no matter how much you think you want to exercise, you want to talk about nutrition, you want to change your habits, the challenges are still many. What do you think are the main challenges people feel when we are talking about diabetes management? Because it stays with you.
Sure. Thanks, Mukta. It's a great question. Probably the way I look at it is I differentiate the problems for my individual patient in front of me versus what really our government and society has to do for the population at large. And that's because in the latter, there's just so much expense. If you look at diabetes and you look at obesity and cardiovascular disease, it's nearly bankrupting not only the American system, the Indian system, and around the globe. But let's talk about an individual patient. It's really about awareness. Probably half of patients with type 2 diabetes in India are just unaware. Maybe a little bit better now, but it's about half. Now in the States, it's less. It's maybe about a quarter. But when you look at the part of diabetes that occurs before the sugars actually hit those levels for diagnosis, we call it prediabetes.
Right.
Could be as high as 80 to 90% of Americans are unaware. So how on earth are you going to bend the curve if the patients aren't aware And that actually implies even the physicians
True.
aren't even aware. That's the main challenge.
You know, that takes me, Agnes, which is we don't go for tests very often. In the modern cities, we go for pre-diabetes screenings, etc. We never get to know till the time we are actually struggling with something really big, and then that's when people find out that, oh, this is diabetes, this could be diabetes, or this is getting complicated because of diabetes. Which aspects of lifestyles create the biggest impact on diabetes outcomes?
You are right, Muda. Lifestyle is definitely the most important part of diabetes care. So I will break it into 3 different parts. The first part is definitely good nutrition. We know that nutrition is the foundation of having good life. And when we talk about good nutrition, we look at low glycemic carbohydrates because these are the carbohydrates that do not spike the blood sugar as much compared to high glycemic carbohydrates. So in terms of foods, we are talking about whole grains, legumes, and also brown rice. And we should really minimize sugar-sweetened beverage, sugars, desserts, and also all the refined grains. And the second step is really physical activity. We all have prolonged sitting most of the time. So we really need to break the prolonged sitting, try to exercise more, brisk walking, yoga, strength training. All these are very important. And the third thing is really to have good quality sleep. Try to sleep at least 6 to 8 hours a day to really improve the glycemic control.
All of those checklists, when we talk about lifestyle changes and habits of people, you're watching television or you're watching your screens for a very long time, you prioritize things over exercising, you are eating a quick meal, or you're buying something that is satiating your hunger but is actually not nutritious. You know, these are things people are almost every time fighting with, right? But Doc, for me, what is important to understand is there a diabetes specific diet or a diabetes friendly diet that can be part of our regular routine? Because in India, we do eat everything that is prescribed, yet we see that our nutrition levels are not met. So what are we exactly talking about?
Right, so there's different ways to look at diet per se. The way that I look at it is in terms of a dietary pattern. So there's no good or bad food individually. You really need to look at foods in aggregate. What is a human being consuming over a defined or predefined period of time? Now, Agnes has gone over some of the changes in the main groups in carbohydrates, having healthy carbohydrates that have a low glycemic index, low glycemic load, proteins that are healthy, proteins not associated with some of the unhealthy fats that you find in meats, for instance. And then fats, healthy fats, fats that are to some extent not fully saturated, so monounsaturates and polyunsaturates. And those can be found in plants and also some animals like in fish. But there's other aspects of nutrition besides just the particular foods or pattern of foods. For instance, the timing of eating. Now, I am sure in many of your other conversations, a question that always comes up is intermittent fasting and time-restricted eating and skipping breakfast and when I should eat. And this really represents research gaps. We need more research to understand what's the ideal human diet. The bottom line is it should be diet, it should be whole foods. We should try as best we can to eliminate processed foods, probably not skip meals, probably not have a big meal very late in the day so our food intake matches our own biological rhythms. And my last point, this needs to be culturally adapted. So what we write in our guidelines in America simply is not portable to India, and for that matter, to Southeast Asia or Latin America. And there's a lot that's been published on this, but this is a practice gap and a knowledge gap. People aren't aware they need to culturally adapt.
No, that's so true, because we tend to look at the inventions that are happening outside of our audience group, and then we try to take the best out of that practice, which perhaps may not be applicable to our subset. For instance, in India, if you look at supplements, I'm perimenopausing. I need supplements. I need my proteins. I need my multivitamins. And I do need a specific nutritional formulated support. Do we have something like that for diabetes as well, Agnes?
That's a great question. Yes, we do have diabetes-specific nutritional formula. They are specifically designed for people with diabetes to address their nutritional needs and also to help glycemic control in these patient groups. So diabetes-specific formula, it actually has slow-release carbohydrate system, unique fiber blend, and also it has high protein and with the good fats. That's important for people with diabetes. And more importantly, with this diabetes-specific formula, it's very convenient and it's portion control. And we know that many people actually struggle with meal planning and also estimating the serving size. And that actually will lead to like nutritional gaps and also overeating. So with diabetes-specific formula, it is very easy to incorporate into the diet. It's the right nutrition in the right proportion every single time.
I think nutrition is the key for everything. Even when you're trying to lose weight, which is a straight outcome of diabetes because obesity is such a huge part of us Indians, that 70% is nutrition, what you eat, and 30% is your consistent exercise. So you cannot have a mindset where you can eat everything and not exercise, or just keep exercising and not eat the right food. But the same thing goes for medicines. A lot of people in India feel that with modern medication, everything can be handled with meds. Or I can have a magic pill that helps me reduce weight. But what they don't understand perhaps is that not all body types. Could you also explain how, even with the new medical advents, it still is something that we cannot prioritize over nutrition?
Yeah, so look, you bring up a really good point because, first of all, there are a lot of non-biological determinants of health that figure into our understanding of chronic disease, one of which is socioeconomics. So before we even begin a conversation talking about what we call incretin mimetic drugs, so these injectables that your audience and viewership is well aware of, used properly, they're amazing medications. And these medications actually have effects that extend beyond just lowering blood sugar or controlling the weight by decreasing appetite, adjusting the hormones, decreasing food chatter, for instance. They protect the heart, they protect the kidney, and they will probably have emerging benefits, cancer and dementia and addiction and mental health, these things that are in the scientific literature that we're going to come to find are going to be important. So to get to your question, can a patient flock to one of these medicines, ask their doctor for the medicine so they can continue their unhealthy lifestyle? No. Intensive lifestyle intervention is the mainstay of the management of chronic disease. Judicious pharmacotherapy comes next. We don't prescribe the pharmacotherapy just so someone can squeeze into that bathing suit and be able to eat or drink their white wine whenever they want. So there's a lot of philosophy here, a lot of sociology here, and other things that we physicians need to consider.
And thankfully, also medical guidelines. Yeah. Because if you are following the medical guidelines, you will have to tell the patient that this has to be first naturally handled versus popping a pill or taking an injection. Agnes, India is a different beast altogether, which you will figure out now when you are going to travel and meet a lot more people, which is that every week we will have some other theory popping up about diabetes management, about the nutrition, about what can be eaten, what cannot be eaten. How do you know this is my diabetes friendly nutrition diet and I should just stick to it without getting wavered by so many things that are going to distract me from following that routine?
Yeah. That's a very timely question because we have recently launched our most advanced diabetes specific formula in India. So in this new formula, it has 5 key features. So the first feature is the slow release carbohydrate system and also unique dual fiber blend. It can really help to minimize the blood sugar spikes and it also can help to promote the good gut health. And secondly, it also has a heart healthy lipid blend and it can actually help to give the cardiovascular benefits to the patients and high quality proteins in high quantity. And we know that just by replacing some of the carbohydrates with high quality protein can reduce the risk of diabetes and pre-diabetes. And fourth, we have added myo-inositol, which is a naturally occurring nutrient that has been shown to improve insulin sensitivity and improve glycemic control. And finally, we know that people with diabetes have a lot of micronutrient deficiencies. So we have really enhanced the micronutrient blend by increasing the level of vitamin D, chromium, zinc, calcium, and vitamin Bs. Because all these nutrients are very important for people with diabetes, can help to meet their nutritional needs and also to improve glycemic control, immunity, and to reduce their tiredness.
I want to ask, is this only for diabetic people or can regular? Because I seem to have fatigue, I seem to have stress and all the things that age is bringing and our lifestyle changes are bringing. But when we look at fatigue and when we look at stress, it's just not diabetes specific, but perhaps, Doc, it gets a little more exaggerated with diabetes or if you're a pre-diabetic. But fatigue and stress and of lethargy and not feeling up to it, and then of course it takes a total mental toll. Does this formula or nutrition also capable of handling that?
Yeah, so that's a good question. Back in 2010, we developed a whole protocol that was global, looking at it was called the transcultural nutrition diabetes nutrition algorithm. And basically what we did was we tried to look at the use of these very specialized products. So although diabetes is sort of part of it, there's actually evidence that you're reducing some of the other risk factors for cardiovascular disease. With the weight going down, with blood sugar improving, you also see blood pressure, you see cholesterol, you see markers of inflammation. These are all the things that figure into decreasing cardiovascular or cardiometabolic risk. So back in 2010, when we put together this algorithm, what we did is precisely what you're saying. We came up with recommendations. Now, there is a research gap here because we don't really have compelling data to support it, but it was expert opinion. We convened key opinion leaders from around the world. So this was local to each of the various geographies. But if you were overweight or if you had high blood sugars, fine. There were guidelines for taking 1 or 2 a day. If you were underweight, so let's say you had some pancreatic surgery and you weren't able to make insulin, but you needed the nutrition, there were guidelines. But we also had guidelines for those that had normal weight and normal blood sugar. And what does that mean? It's talking about prevention. So if you have somebody who is at risk for chronic disease, and frankly we all are, we live in an obesogenic environment, a diabetic-genic environment. There are family history components. You asked about distractions. So if a doctor gives a patient a lot of instructions and then they walk out the building and they're distracted because of the donut shop that's right around the corner, those are environmental drivers that interact with behavioral drivers. So actually the answer is that these supplements do work in a wide variety of patients.
Agnes, what are some of the most common misconceptions that you hear or deal with or get to see in your line of work when it comes to nutrition and diabetes management? The studies keep changing, people have their own views, but there must be some evidence.
Yeah, that's a very good question because there are so many misconceptions out there. The first one is the thing that I've heard before is people with diabetes should avoid all carbohydrates. They should not consume any carbohydrate at all. And we all know that carbohydrates is an essential source of energy, and it's important for them to consume carbohydrate. The key is to choose low glycemic carbohydrates, the good carbohydrates that do not spike the blood sugar as much, like whole grains, legumes, all these are good for them, and try to avoid refined grains. And the second thing that I've heard is that a very strict non-vegetarian diet or a very strict vegetarian diet is best for diabetes management. So to me, it's really the quality of the protein and it's not so much of the source. So as long as we can get high quality protein, both vegetarian and non-vegetarian diets will be good. Like we can get it from dairy, lean meat, fish, or even tofu. Yeah. So the other thing that I would like to emphasize is if we go for diabetes-specific formula, it can really provide the low glycemic carbohydrates and also high-quality proteins with the healthy fat and essential vitamins and minerals to help people with diabetes to manage their condition. So I think one of the most important things is to look at the clinical evidence. And we have recently completed 3 clinical studies using the latest diabetes-specific formula in India. And in these studies, and we have shown that diabetes-specific formula can significantly improve glycemic control and also improve the body composition by reducing body weight, fat mass, and visceral adipose tissue, while preserving fat-free mass, meaning that it can promote quality weight loss. And the other thing is it has also been shown to improve blood cholesterol and blood pressure.
Before I let you go, even though we can talk a lot about this, but obviously we have to stick to timelines. Before I let both of you go, one word of advice for patients and one word of advice for doctors as to how they can help their patients prioritize nutrition versus asking them if they want to take more medication or, have to go the route which is not natural.
Yeah. From my standpoint, it's being personalized and being comprehensive. So as Agnes said, it's not just about nutrition, it's about the other pillars of lifestyle medicine, which is nutrition, physical activity, sleep hygiene, community engagement, wearable technologies, right? Wearing those pedometers or accelerometers, right? And behavioral, low stress, working on mind, body. That's all part of comprehensive lifestyle. That's the way I do it.
Wonderful. And what would you say, Agnes, for both pre-diabetics and diabetics about one most important thing that can go a long way in managing diabetes?
Yeah, so that's a great question. So to me, nutrition is the good foundation and they should really focus on their nutrition. And medical nutrition therapy for diabetes management is clinically proven to actually help people achieve their treatment goals. And to me, the most important part is really considering using like diabetes-specific nutritional formula, those that are scientifically designed for people with diabetes, and it is also clinically proven to be efficacy in this group of patients.
Well, wonderful to have heard all of these great nuggets. Thank you so much for that insightful conversation. This was really, really fantastic. Thank you so much. Thank you.